Inside the womb, a well-developed fetus experiences a surprising range of sensations. As organs mature, senses form one by one: touch first, then hearing, taste and smell, and limited sight. By the third trimester, responses are clear and measurable. Touch is the first sense to develop. Receptors appear around 8 weeks. By mid-pregnancy, a fetus explores its world, touching its face, sucking a thumb, even holding the umbilical cord. These movements help muscle and neural development. Hearing develops next. The womb is far from silent. By the third trimester, a fetus can hear the mother's heartbeat, voice, and muffled outside sounds. Newborns often prefer voices and stories they heard in utero. Taste and smell are linked. Flavors from the mother's diet pass into amniotic fluid. The fetus swallows fluid and samples these flavors, which can shape later preferences. Studies show prenatal exposure can influence early food choices. The womb is mostly dark, but light can penetrate the uterine wall. Late in pregnancy, a fetus can detect brightness changes and may track simple light patterns. Light sensitivity is limited but present. The capacity to feel pain develops late. Neural pathways required appear around 29-30 weeks. Before that, stimuli may change heart rate or movement, but not conscious pain as adults understand it. Medical researchers caution careful interpretation of fetal reactions. In short, touch, hearing, taste, smell, and limited sight emerge progressively before birth. These senses help shape bonding, learning, and early preferences. Next, how oxygen and nutrients travel between mother and baby. A fetus doesn't breathe air. Its lungs are fluid-filled and developing. Oxygen-rich blood from the mother reaches the placenta through her circulation. At the placenta, oxygen and nutrients diffuse across to fetal blood without direct mixing. Oxygenated blood enters the fetus through a single umbilical vein in the cord. Special shunts, like the ductus venosus, partially bypass the fetal liver to prioritize oxygen delivery. This enriched blood is directed to the heart and brain, the most vital organs. Darker, deoxygenated blood returns via 2 umbilical arteries to the placenta. The placenta moves carbon dioxide and wastes into the mother's circulation for elimination. Until birth, the placenta performs the gas exchange role that lungs will take over after delivery. This system is highly efficient. Small changes in maternal oxygenation can affect fetal oxygen levels. Good maternal health, nutrition, and avoiding smoking help ensure healthy oxygen supply. At birth, the baby takes its first breath, lungs inflate, and circulation reroutes to the newborn pattern. Now, a quick look at the major stages of prenatal development. Stage 1, the germinal stage, weeks 1 to 2, begins at fertilization when sperm and egg form a zygote. Rapid cell division follows as the zygote travels to the uterus and becomes a blastocyst. Implantation into the uterine lining triggers pregnancy hormones and marks the end of this stage. Week 3 to 8, the embryonic stage, when organs and systems begin forming. The heart starts as a tube and begins beating early, while the neural tube, future brain and spine, closes. Arm and leg buds appear and basic facial features take shape. The umbilical cord becomes functional. This stage is critical. Development is rapid and vulnerable to environmental factors. From week 9 until birth, the fetus grows and refines organ systems. Movements become coordinated. By about 20 weeks, many mothers feel quickening. Senses mature. The fetus practices swallowing, hears voices, and responds to stimuli. In the third trimester, the fetus gains weight rapidly, and the lungs near completion. Many babies move into a head-down position in preparation for birth. Prenatal care helps monitor growth, position, and well-being as delivery approaches. Ultrasounds and checkups track milestones and guide decisions if interventions are needed. From a single cell to a full-term baby, germinal, embryonic, and fetal stages map that journey. The senses and systems developed in the womb prepare a newborn to meet the world. This video is informational. For medical advice or diagnosis, consult a healthcare provider. Thank you for watching, and congratulations on your growing family. Be sure to subscribe to and like SCO's YouTube channel.